You know, there's nothing worse than meeting someone for the first time, shaking their hand, and then being hit in the face with a blast of bad breath. And joining me on the line now is Dr Jeffrey Speiser, Director of the Australian Breath Clinic. Hello, Dr Jeffrey.
Hi, Ernie. How are you?
Good. Thanks for your time.
Pleasure.
Now, what is actually bad breath? Is it from the mouth? Does it come from other areas, or is it all oral?
95% of bad breath is from the mouth and the throat area. A lot of old wives' tales out there, so some people will say that it comes from the stomach, and that's just basically a misunderstanding of the problem.
Yeah, so it's all in the oral cavity area.
That's correct.
Yeah, and is it treatable, or do people suffer with it for the rest of their lives?
It's treatable. There are so many causes to it, right? In general, it's treatable. The people that we may classify as non-treatable because they may have another illness that's adding to this, it's maintainable with those people.
What are the most common causes then?
Well, the most common causes is basically a change of the bacteria in the mouth, and this could be due to hygiene issues, could be due to their lifestyle, could be due to a chronic illness they may have, medicines, or such things as antibiotics. 7 of the 10 top prescription medicines are causes of bad breath.
Really?
Yeah.
What, heart pills and
that's correct.
Cholesterol and blood pressure pills?
That's correct. They all have side effects of drying your mouth out, and that increases bad breath.
Gee. So, and of course, I guess the person with the bad breath never knows they have bad breath, do they?
Very difficult for them, and it plays on their personality. I mean, really, they gauge their problem by people's reactions to them. Yeah. And they can misinterpret those reactions as well, so it is very difficult for them.
How can it be treated, bad breath be treated? Which is the best way? Well,
temporary bad breath that you may have if you if you have a lot of garlic, things like that, that's going to balance itself back out. The chronic issues, the people that are on the medicines and the life and have the illnesses that we're looking at, and really what they have to do is 3 things. One, they've got to change the type of bacteria in their mouth, and currently that can only be done by using a special mouth probiotic that you put into the mouth. Second thing you've got to do is you've got to remove the coatings where the bacteria live. So, for example, on teeth it's called plaque. Between the teeth you've got to use floss. On your tongue you've got to scrape the coating that builds up on your tongue. And if you've got coating in your throat, you use saline nasal sprays.
Yeah, because I've always done that with my tongue, particularly for my voice early on in life when I was a singer. I've always done that with the toothbrush, and I do it now as a habit. I've always just cleaning the tongue as well. Well, a tongue cleaner is more effective than a toothbrush. It's hard to get all the debris off just with a toothbrush, but it's a good start. Yeah. So what are probiotics? What exactly is a probiotic?
Probiotics are billions of friendly bacteria that live within our body, and they're good bacteria. So you will find, for example, that we all have good and bad bacteria. Some of us have variants of these good bacteria that actually can defend their own territory. So if you can put a good bacteria, say, for example, that normally lives on the tongue surface in your mouth, it can actually help to diminish the number of bad bacteria that will live there as well.
What about things like sprays? You know, they have sprays for people for bad breath. At that, do they really work?
For 5 minutes, they're masking agents.
5 minutes, yeah.
Yeah.
So you've got to find where the problem's coming from.
That's right. Most commercial products, mouthwashes, toothpaste, throat sprays, they're masking agents. So you've had a garlicky lunch. You need to sort of hit yourself with a bit of a spray. That's basically where they come in.
Actually, I've got a caller on the line. Do you mind taking a call?
Sure.
Terry, g'day, Terry.
Yeah, hi.
You got a call for Dr. Jeffrey?
Yeah, Jeffrey, I've got a son who's 15, he's ADHD, and he's been on Ritalin for some years, and we've always found that bad breath's a bit of a problem with him. What do you advise?
Children, you treat a bit different to adults, mainly because the bacterial changes in children aren't as entrenched as adults. So with children, what I like to do is definitely get them into the tongue cleaning, avoid dairy products, because dairy is a very big factor in bad breath.
Really?
Yes, and also dairy will thicken weaken their nasal mucus, which is the number 2 cause of bad breath. So look at avoiding dairy and nasal mucus out of their diet. Look at it being very stringent in their tongue cleaning, and avoid all the commercial mouthwashes. And in general, that will take things a long way. Maybe add a saline nasal spray.
Yeah. What about people with false teeth? Do they tend to have worse breath than a person with their own teeth?
Not if they're keeping their dentures clean.
Oh.
I mean, because it's not a problem from the teeth, it's from the tongue and the back of the throat. So they've only got a problem if they're not cleaning their dentures and they've got food and bacteria trapped in there.
Actually, what Terry rang about was exactly what you said. That's medication has caused that.
That's right, yeah.
Yeah, I didn't realise that medication could do so much.
Well, you look at all the different things. People get hay fever. They take medicines to dry their nasal passages. The mucus is there. It then gets filled up with bacteria. The bacteria cause the problem.
Yeah. Now, you can use probiotics in the treatment of bad breath, can't you?
It's one of the steps of the treatment, yes.
Yeah. What about taking vitamins? Could taking vitamins cause your breath to be a bit off?
Taking vitamins may or may not. It's really difficult to make a judgment on that. That's getting more systemic. We're looking specifically at local factors.
What's the K-Force and Breeze range products available from the Australian Breath Clinic?
Well, K-Force was our invention. It was using this probiotic that we were talking about. We have an association with Dunedin University, Otago University in Dunedin, and they were the ones that discovered this particular probiotic. They actually followed a range of school kids in Dunedin, and they analysed their saliva over a number of years, and they looked at why one child was getting sick and another child wasn't getting sick, and they found this particular bug was living in the healthy kids.
Yeah.
So they've isolated it and turned it into a probiotic. So our system basically uses this probiotic to place it back into people's mouths, artificially change their bacteria, and then we have a special cleaning gel with our tongue cleaner for cleaning the teeth and the tongue, and then the lifestyle guide that tells you things like the medicines, the dairy products, smoking, coffees, alcohol, all those sorts of factors that trigger bad breath bacteria.
Yeah. Well, what's the best food to have to freshen your breath with? Is there a specific herb, fruit, veggies, or anything like that?
There's more foods to avoid than to take. For example, if you look at vegetables, anything that you cook up that will smell like Brussels sprouts or cabbages already have sulphur in them, so they're going to cause problems. But having lettuces and carrots aren't going to cause problems. Obviously, avoiding garlics and onions would be good. The high fibre, things, so celeries, apples, oranges, they're all good. Having carbohydrates won't cause a problem, yet proteins will.
So can people get in touch with you up there in Sydney?
Yes, they can. We've got a couple of ways. We've got a website which has a lot of information, and we usually recommend people start there so they can sort of browse it at their own sort of time. Yeah. And that's BreezeCare, BreezeCare.
BreezeCare.com.au. BreezeCare.com.au, yes.
Or they can ring our toll-free number, which is 1300 653 335.
335. That's 1300 653 335 or www.breezecare.com.au.
And we're more than happy to talk to anyone and talk to them personally and go through a program with them.
Well, which a lot of people would like to do, if they'd like to keep it confidential. Give Dr. Jeffrey Speiser, Australian Breath Clinic, a ring on toll-free number 1300 653 335, or you can get in touch with them at www.breezecare.com.au. Thanks a lot for your time, Dr. Jeffrey. I do appreciate it.
Thanks for having me on the show.
Pleasure. Dr. Jeffrey Speiser, Director of the Australian Breath Clinic. And if you do have any problems with the breath, then give that number a ring.